So having worked in the health service for a long time, I have to look at different ways of how we can improve it. And I've listened to a lot of audiobooks, and this is one of them, and this is what this is based around. And we go through a hierarchy of learning, so we never really learn to think different. We always have to pass exams, and often they're just what the lecturer thinks is a good idea. Lots of cases for this, and I remember that distinctly when I was a student over 40 years ago. So this is one of the PDFs from the audiobook, and it's basically trying to work out how we can integrate all our knowledge in a meaningful way. So this is just the dental team as such, and in most businesses a lot of the good ideas have come within the team. They haven't come from the boss, in this case the dentist, they come from the team, and we're neglecting this group to a huge extent and underutilising them. So what we need is some kind of system whereby these voices get heard and not shouted down, as often is the case if you think about consultants in medicine really. So if we're looking at our health service, then these are things that are all part of it. And unfortunately, the government talk about an integrated service, really it's not there, and it won't be there. We still are stuck with these same hierarchies, and we need to embrace them, not neglect them. So successive governments have wasted billions on IT projects for the health service, but this is a resource that we can use. It's what everybody pays for. We all have a contract for our phones, and so we need to, as you know, think a bit different on how we can help the health service, even if we don't really work in it. And that's by being a health advocate, promoting prevention. We just need to get ourselves organised. Unlike Big Pharma, who are organised, but the last thing they're going to do is to create a cure for tooth decay. And what we're looking at now is the same common problem, which is sugar. If you go onto YouTube, quite a few good videos explaining not so much the damage that sugar does to teeth, but the damage sugar does to our body. And we have a common enemy with the health, and that is sugar. So why don't we do more about it? Well, that's the government's responsibility really. While big companies such as Sainsbury's and Tesco know what goes on in your club card, they could at least let you know how much sugar you're eating every month. It's not that difficult, it's just there's no reason for them to do it. For example, the data on alcohol bought compared to what we say we drink doesn't tally. We're just kidding ourselves. So while dentistry in the main is being excluded from the health service, it doesn't mean that we can't promote it. And really at doctors' surgeries, we can have these videos just there while you're waiting to be called an hour late. We're in the process of empowering other members of the dental team, and I'm sure this is the case in all aspects of health, but there just isn't enough money to fund these new positions. But we can do it outside the health service, and we can do it online. That's what we did during COVID. We just need to improve it. So everyone should be familiar with this. It's not rocket science. But what is new is the association of gum disease to our general health. And really the focus should move on to them, especially once we get to the age of about 20, and hopefully we've never had any fillings. We need to concentrate on cleaning the gum. The government maybe could promote that sugar is worse than cannabis. There's an argument for it. It's certainly addictive. So let's consider how we can improve things. We can have mobile treatment units, and there are 6 in the UK that were really for third world countries, but that's where we are with dentistry. We've got the traditional dental surgery, which we'll always need for treatment of what people need and what they want, but we can use this. AI is a big help when it comes to digital and teledentistry. You're looking at this now. We can have mobile nurses who go to care homes, and also we can have alternative shops that don't provide treatment, they just provide scanning and radiographs, and they can all be linked through a cloud with a treatment coordinator. I made this slideshow over a year ago, But since then, it does look like the health service is trying to catch up. But we need teledentistry in order to help encourage people to do these new activities. There's an awful lot that we can do now that doesn't involve seeing a dentist.